No. Hi, my name is Fatima Sen.
My name is Alejandro Raigosa.
My name is Abigail Sima,
And my name is Ashley Sima.
and today we are going to explain about the last pandemic, COVID-19. During the COVID-19 pandemic, there were many rumors about if you get the vaccine, you will get COVID. Or a rumor that was widely heard was COVID doesn't exist if you look into it. Like those talks, there were too many. Of course, the government announced that we have to quarantine if we want to take care of ourselves. In addition, if people do not wear masks in public places, the risk of transmissions of the virus increases considerably, resulting in more people becoming infected and health authorities having to implement tighter restrictions. It should be emphasized that if people follow sanitary recommendations on frequent hand washing, the probability of contracting the virus decreases, which contributes to not only individual but also collective protection. If people are vaccinated against COVID-19, they reduce the risk of becoming seriously ill. If a person is vaccinated, they not only protect themselves but also help protect others by slowing the spread of the virus. Also, if governments implement vaccination campaigns, the rate of infection generally decreases in the population. If the vaccines are administered properly, they have a high efficacy in preventing severe cases of COVID-19. This means that if a person receives all the recommended doses, the chance of hospitalization is significantly reduced.
Lo de la pancita.
As the world continues to face the COVID-19 pandemic, many experts agree that getting vaccinated is one of the best ways to protect ourselves and others. If you get the COVID vaccine, you will be less likely to get seriously and is especially important for people with underlying health conditions. If more people get vaccinated, the pandemic will end sooner and life can slowly return to normal. However, some people are still hesitant about receiving the vaccine. If you don't get vaccinated, you may be at higher risk of contracting the virus, which could lead to severe illness or even hospitalizations. On the other hand, if you receive the vaccine, you will help to protect others in your community, especially those who are more vulnerable. In addition, if you take the booster shot, you will have stronger protection against new variants, which are a growing concern. If you get the vaccine, you will be able to travel more freely, as many countries are requiring proof or vaccination for entry. Personally, if I get the vaccine, I will feel safer when going out in public, knowing that I am doing my part to protect myself and others. It's also important to note that if you don't get vaccinated, you may face travel restrictions in some countries, as many patients have implemented vaccination requirements for
If people had taken the COVID-19 pandemic more seriously from the beginning, the virus would not have spread so quickly. If governments around the world had coordinated their response better, the impact on global health systems would have been less severe. Additionally, if everyone had worn masks and practiced social distancing, the number of cases would have dropped significantly. If misinformation about vaccines had been addressed sooner, more people would have trusted the science and gotten vaccinated. If more countries had shared vaccines with poorer nations, global herd immunity would have been achieved faster. On a personal level, if individuals had stayed home during lockdowns, they would have protected themselves and others from infection. If schools and businesses had implemented strict hygiene protocols early, fewer outbreaks would have occurred in these environments. Similarly, if healthcare workers had been provided with better protective equipment, their safety would have been guaranteed. If testing and contact tracing had been more widespread, the virus would have been contained more effectively. Finally, if people had understood the importance of collective responsibility, the world would have recovered faster from the pandemic.
In pandemic, the development of vaccines marked a turning point in the fight against the virus. However, not everyone took advantage of this scientific breakthrough. If more individuals had received the vaccine earlier, the virus would not have spread so quickly, and many lives could have been saved. Unfortunately, delays in vaccination efforts led to severe consequences around the world. If governments had distributed vaccines more efficiently, hospitals would not have been overwhelmed with critically ill patients. In some countries, vaccine rollouts were slow due to logistical challenges. If authorities had planned better distribution strategies, fewer people would have suffered. Additionally, if global leaders had cooperated more effectively, vaccines might have reached vulnerable populations faster. Scientific efforts were remarkable. If scientists had not developed the vaccines in record time, the pandemic would have lasted much longer. However, the scientific achievement alone was not enough. If public health organizations had communicated the vaccine's safety and effectiveness more clearly, public trust might have increased significantly. Many people hesitate because of doubts and misinformation. If misinformation about the vaccine had not spread so rapidly on social media, more people would have accepted immunization. Unfortunately, false claims created fear and confusion. If stricter regulations had been implemented to control false information online, the public would have been better informed. In some families, tragedy could have been avoided. If vulnerable individuals had been vaccinated sooner, they might have survived the worst waves of the pandemic. Many elderly people could have lived longer if vaccination campaigns had reached them earlier. If communities had worked together and followed safety guidelines while waiting for vaccines, infection rate would have decreased. School business and daily life might have returned to normal faster if more people had taken the vaccine when its first became available.